So let's go back. You said that you found this, and I don't know if you called it new or different or what word you'd use, healthcare system, and you were investigating it and looking at it. And so tell us more about that.
And blown away by it.
Yeah,
There's
blown
no
away
question
by it,
that
yeah.
Here I had been for 25 years pushing prevention and relationship-based healthcare, and how do we bring in relationships more, and how do we get people to stay healthy in the first place? And I was listening to a podcast by the medical director of this South Central Foundation's NUCA system of care, and they were sharing the design of their healthcare system. And I was like, oh my gosh, I can't believe I'm hearing this. Mm-hmm. Here's a system that's managing the health for 70,000 people.
Okay.
And they're getting the very best outcomes in the world. They're getting the highest level of satisfaction in the world. And they're spending half as much on healthcare. And I'm like, everything he's saying is exactly what and everybody would believe, it's intuitive, but somebody went out and proved it. And now that someone's proved it, it's like we just need to introduce to CEOs that they can expect more. It's okay to expect to get what you want. And you don't have to go fix it. You don't have to go implement it. All you got to do is align the system to want to work for you to help you get it. And it'll just flow. It's not hard.
So let's go through the system. You've talked about what the CEO has to do, but where and what benefits do the providers get, and where and what benefits do the employees get when they get into the new system, and what can they expect?
So it's interesting. Healthcare is often built around the idea that when someone gets broken, let's fix them.
Right.
And the healthcare system is generally putting hospitals at the bottom of the cliff so that when someone falls off, we fix them.
Right.
Well, this aspirational model of healthcare is about, what if I were to partner with you on your journey through life, helping you be successful in whatever your dreams and aspirations in life are, so that we prevent you from falling off the cliff in the first place?
Okay.
And so they build an entire healthcare system. I'm going to tell you a little bit about the background. So here, this system that was managing 70,000 Alaska Native people in Alaska based on Anchorage was given the opportunity to build their own brand new system.
Okay.
And they did something that nobody's ever done in healthcare before. They went out and asked their customers what they wanted. Imagine that.
Imagine that.
And what their customers said was, well, we don't want a paternalistic system that just tells us what to do when we get broken. We want a healthcare system that helps us reach our dreams in life. We want a healthcare system that partners with us, that's on our journey with us. And so they said, that's a fabulous idea. We have control over this brand new system that we're going to build. Let's build a system that looks like that. So they started off with what they call massively powerful primary care, based on relationship.
Okay.
And so they were assigned a small panel of patients out of the population. So no team of providers had like thousands of patients. They had a small number. And their whole goal was to reach out to every one of those members, patients. They don't even call them patients. They don't even use that. They use them customer owners is what they call them.
Okay.
But to reach out to every customer owner and get in a relationship with them of trust. Have them tell their story. Let them explain what their background is, what their dreams and goals are, so that you can be a partner with them to help them reach that. And now when something does happen, they trust you.
Right.
There's a relationship with you. And they have easy access to you. They can pick up the phone and call you. You're not having to go in and make an appointment and wait in line, get in a doctor's office and have to be there for a while. It's like, it's a connection. It's an easy access to when I need something. So they built their entire healthcare system where the priority was relationship. Now, not that science isn't important, because science is important. But in healthcare, in the end, relationship is actually more important than science. Because if the patient's not going to do, customer's not going to do what you prescribed, what good was it that you knew everything you needed to know to prescribe the best treatment plan? It's like, it doesn't do any good if you can't build a relationship where they're willing to trust you and actually go implement it. And when they see you as their goal was to have every member of their population see their provider team like they would their dad. Like if your dad was a doctor, you would call your dad if you had a concern or if you wanted some help. Their goal was to set up the relationship such that everybody thought of their provider just like they would think of their dad. That kind of a relationship. And that's not how healthcare is built. That is completely different the way healthcare is built.
Right.
And so by building healthcare around a very relationship-based, easy access, massively powerful primary care system. When I say massively powerful primary care, I mean there's a lot of things that primary care can do when they're not constrained by, well, I only gonna get paid if I give you a treatment.
Right.
And I got to see a whole bunch of patients every day so I can send everybody out to a specialist and so I can get as many patients in every day. It's like, no, what if healthcare was built around the idea that, no, I'm going to give you all the time you need.
Right.
And I'm going to really help you. And I'm really figured out how my helping you helps you reach your dreams in life. Well, they build a system where the doctor wasn't under some massive pressure to see a bunch of people every day. And so by doing that, members, it didn't happen overnight. It wasn't like all 70,000 people started seeing their doctor differently. It took a long time to absorb this new relationship-based healthcare system. But the idea is that they proved that a system can be different and can be much better.
Right.
And so now all we have to do is get the customer who buys healthcare to say, I want that.
Right.
Go do it. And it can be done. And the book even talks about how easy it is to implement. But the CEO doesn't need to be the one that implements it. They just have to align the system that they're paying to give it to them.
When this is rolling out, just give us a snippet of how the employees, which I would consider the bottom of the food chain on this, are getting pulled into this and how they're reacting to the difference of this whole healthcare system and how they feel about it. Because you use the word dreams and not how healthy I want to be or how unsick I want to, people can call it whatever they want, but I've never sat down and thought to myself, my dream is to be this, healthy. But I do worry about doctor's appointments, like most of us, or how much it's going to cost me out of pocket, or will I get into the doctor? Can I find a specialist? So let's start with the employee and then move up the food chain to the CEO. Once they know that their employees are taken care of, how does it start with the employee?
Well, one of the aspects or principles of the whole aspirational model is choice.
Okay.
So you can't force a good thing on a person and expect them to like it.
Right.
You can pass out tickets to heaven, and people are going to reject it.
Right.
It doesn't matter what you're passing out. If you're telling them they have to do it, they're not going to like it.
Right.
So one of the aspects that is important in rolling out this model is to give people a choice. Say, look, here's a plan, and you have a choice to be in an aspirational model, or you have a choice to consume healthcare the way you always have.
Okay.
And if you want to keep paying copays, and you want to keep paying deductibles, and you want to keep paying high premiums, you can keep consuming healthcare like you always have.
Got it.
Wait in the waiting line, get at the office, spend an hour there waiting, you have to leave work. You can do that. Nobody's going to tell you you can't.
Okay.
But if you would like to consume healthcare in a more customer-centric way, then don't pay copays, don't pay premiums, don't pay deductibles,
Right.
and now consume healthcare that's going to be less expensive, better outcomes. So it's giving people the choice and not forcing everybody into that. It's like you just simply set the plan up to where everybody gets to choose what they want. They want to keep consuming healthcare the way they always have, let them. If they want something better, don't force them into it. Let them see how good it is, but create incentives. It was like, well, yeah, I don't want to pay copays. I don't want to pay premiums. I don't want to pay deductibles. I'm going to go over here.
So now we get the employees to consider both. And the CEO is watching this happen. How are they feeling about it? Like, or even HR, like what is their...
What CEOs need to do is define their goals.
Okay.
And if their goal really is, like I hear most of the time, to attract and maintain top talent, then
Right.
CEOs should be monitoring that.
Got it.
CEOs should be sending out a survey every year, if not twice a year, asking their employees whether or not the benefits they offer, and it includes all the benefits.
Right.
It could be the dental, the vision, all the benefits, the PTO. But ask the employees, how well are my benefits that I'm offering you working at keeping you here? How well did they work to attract you here? So the CEO just needs to ask his team, her team, to ask the question to see whether it's working. Gather the data, and like they do with everything else, have a dashboard. Simply have a dashboard that they can monitor regularly that says, I'm spending money on something that's working.
Right.
Now, sure, they can hear from the employee. I got to tell you, in fact, I was just talking to yesterday, one of my employees who I never knew was taking full advantage of some of the benefits that I offered that are aspirational. And she said, yeah, I've never told you, Darrell, but I live and breathe off the relationship I have with my provider. And I'm using just like the one you talk about. It's like, it's an amazing experience. I'm like, I never knew that, So sometimes you'll hear it, but you're not going to hear it from everybody. So
Right.
measure it. Just simply ask the question and then look at the data, the dashboard, and see whether it's working.
Right.
It's that simple.
It's better than, oh, by the way, here's your increase year after year after year. Right. because we all know how that feels. So let's talk about the providers that are in this system, or how do they even consider being in the system? And I don't want to give away anything you may have covered in the book, but I'm just asking.
No, I'll be happy to share what I've got in the book. I mean, the whole thing is, it's really changing primary care.
Okay.
And I refer to in the book that when you offer an insurance plan to your employees, and often that insurance plan, whether it's self-funded or a fully insured plan, has a network.
Got it.
And the employee takes the network and they open it up, and they're all very trained on, I want to go to a network provider, and hopefully I can find a good one, right?
Right.
What nobody realizes is that the majority of the providers in that book, in that provider list, are owned by the hospital systems.
Right.
Now you might ask, well, why is that a bad thing? I want to go to a great, brand healthcare system provider. That
Right.
makes a lot of sense, good quality care. Well, having run hospitals, I know why I buy practices.
Right.
Hospital administrators don't buy specialists and primary care practices because they're trying to create this great quality healthcare system. They're trying to control the funnel source. If I live and breathe as a hospital administrator based on how many people are in my beds, then I can't advertise. I mean, I can do some PR, but you're not going to advertise to go, hey, go get sick and come get in my bed.
Yeah.
But what you can do is you can buy all the funnel sources.
Right.
And if I buy up all the practices, as most healthcare systems have, I mean, in almost every market, almost every practice is owned by a healthcare system. And when you look at the provider network, it's like, which system are you in? Well, there's a reason those systems buy those practices. They control, because if I control the funnel source, nobody holds me accountable to quality, and nobody holds me accountable to cost.
Or outcomes.
Outcomes. I can provide terrible care, terrible outcomes, and nobody cares, and I can charge anything I want.
Right.
And that's how healthcare works. So until the customer says, no, you're working for me, and that's not okay,
Right.
it has to change. So the front door is often primary care.
Got it.
And as long as what you're going to offer your employees is a network of a whole bunch of primary care practices who are owned by the healthcare system, you're feeding the dragon.
Right.
Bottom line is you're feeding the dragon.
Right.
So why not? I'm not saying take it away. I'm just simply saying, yeah, that's how you consume healthcare in the past, but I'm going to now give you another option. And some people refer to it as subscription-based advanced primary care. Some people refer to it as direct primary care. But the idea is that primary care should be aligned to keep people healthy. And
Right.
they should be paid not based on every time someone gets sick, but on a subscription model. Now, I'm not saying specialists should be paid that way, but primary care, yes. So offer your employees that you'll pay for out of that plan benefit dollars for them to go see a subscription-based primary care provider
Right.
or a direct primary care provider. Now you might say, well, Darrell, if I look at the details of my plan, I can tell you right now that a very small percent, maybe 3%, is going to primary care.
Right.
Why in the world would I take this little 3% and triple it?
Right.
Or maybe even quadruple it, so that I'm now spending, instead of $3, I'm spending $24 every employee every month for this thing called direct primary care. Because by spending more money on the front end that's aligned to keep your people healthy, the back end drops in half. And that's what the healthcare system in Alaska proved.
Right.
When you spend more money on the front end, creating relationships and supporting people in reaching their dreams and aspirations in life,
Right.
the number of hospitalizations drop in half. The amount of money you spend in urgent care and emergency room visits drop in half. It's like, it's a simple equation. You spend more on the front end, so you don't spend as much on the back end.
That's great.
And that's what the book basically teaches.